This is a step-by-step guide on how to repair a bucket handle tear of the medial meniscus. A 25-year-old gentleman presented with locking of his left knee after suffering from injury 1 week back. He had a prior history of ACL reconstruction done 6 months prior to the current status. On examination, he had a locked knee, but the knee was stable. On MRI, on the sagittal sections, there is loss of the normal bow tie sign, and we can appreciate a classical double PCL sign wherein we can appreciate the two shadows of the PCL. On the coronal images, we can see the fragment in the notch sign. Begin by conducting a thorough arthroscopic evaluation of the knee ligaments and the menisci, confirm the health of the ACL graft, and identify any abnormalities such as flipped medial meniscus in the notch region. Pay particular attention to checking for root and ramp lesion, which are frequently missed during initial evaluations. Attempt to reduce the flipped medial meniscus to its normal position. Assess the stability of the reduction by gradually flexing and extending the knee joint. Here, the reduction can be seen as unstable as the meniscus is flipped on gradually extending and flexing the knee joint. After determining the location of the tear, surgical repair is undertaken. Perform an inside-out repair for the body and anterior aspect of the bucket handle tear. This technique involves passing suture through the meniscus and knee capsule from inside the joint, then tying them externally. Tie the knot securely with the knee slightly in flexion and in valgus. Complete the repair process by using an all-inside repair method for the posterior horn of the medial meniscus. Evaluate the repaired meniscus for stability and functionality through various knee movements.